Good afternoon. My name is Ricardo Romero Morales. I'm a lead public information officer with the County of Santa Clara. Thank you for being here today. Today we'll be providing an update on guidance to best use COVID-19 testing options here in Santa Clara County. Today we have Dr. Sarah Cody, who is our health officer and director of the public health department here in Santa Clara County, and we also have James Williams, our county consul. We'll start this press conference in English. We will then take questions from the media. After that, we will move into statements in Spanish, Chinese, Vietnamese, and Tagalog from the podium. Without any further ado, I welcome Dr. Sarah Cody.
Good morning or good afternoon. I wanted to give first a little bit of context about where we are in the pandemic locally before I talk more specifically about current testing recommendations. So today, we are just actually 9 days short of marking the 2-year anniversary of when we started formally responding to the pandemic here in Santa Clara County. So we are closing in on our 2-year anniversary. And we are still in the throes of the highest infection rates that we have seen to date during this entire 2 years. We have learned that Omicron spreads like wildfire. And we know that many sectors, including healthcare, education, and many other critical sectors, are experiencing a lot of staff shortages because of illness from Omicron. And we also know that there's a lot of change, a lot of fatigue, and a lot to keep up with. But I do want to offer a glimmer of hope. And that hope comes from our sewage surveillance. So you will remember that when I spoke in December, that was our first indication that we had a problem with Omicron. This is a surveillance system that we track and follow quite closely along with others. And we are now seeing some signs that increasingly make me feel confident that the levels of infection are just starting to come down. What we are seeing is that all 4 sewer sheds that we track in our county are showing a decrease in the amount of Omicron detected. We're by far from out of the woods. What I'm saying is maybe we're starting to approach where we were 2 weeks ago, but at least we're not continuing to rise up. As far as hospitalizations, that's quite a different story. Our hospitalizations are continuing to increase, and we anticipate that that will be the trend for a little bit more because hospitalizations lag the increases in infections. But at least I wanted to just give that little bit of light. We know that there is light ahead. So that's really the context for the comments that I'm going to make about testing. We've always said, and we know now more than ever, that we have to put these layers of protection together. And when we have a shortage of one layer, as we do currently with testing, we have to double up on those other layers and really focus on them. We still have fantastic masks of great quality in enormous quantity. We can use those. We still have lots of vaccination and boosters for anyone who's not up to date, and many other layers. But let's talk a little bit about testing. So we know that in our community, as in many places across the country, our current demand far exceeds the supply of tests that we have. And so that is the spirit for the guidance that we're providing about, so when should you get tested, and when should you use which kind of test? So just a few key points. First, when should you use an antigen test? Those are the ones that you can buy over the counter. Those tests are best used to, quote, test out early from isolation. So if you already know you have COVID and you're just wondering, when am I no longer infectious? When am I no longer a risk to others? An antigen test is the best test to use there. Similarly, if you've already had COVID in the last 90 days, and you get and you need to test again, an antigen test is the best to use. And the reason why this is the other test, the PCR test, is so good at picking up virus, even little pieces of dead virus, that it's going to test long after you're infectious to others. And that's why an antigen test is sometimes the best test to use. So when should you use a PCR? The PCR is still the optimal test if you have been exposed to somebody and you're wondering whether you're going to develop the infection. However, an antigen test can also be used for that as well. A couple other things I just want to note that are super important no matter what. If you have symptoms of COVID, isolate yourself right away. If you have symptoms, isolate yourself right away. We know how prevalent COVID is, and so that's the most important step you should take. And you can use either test to figure out if you have COVID. And finally, and this is really important, please do not use emergency rooms as testing centers. Emergency rooms are there for people who require emergency care. We urge everyone who needs tests to access tests somewhere other than the emergency department. So I just want to return before I close to those layers of protection and emphasize again, testing is an important layer, but because right now, and by the way, we don't expect this situation to last for that much longer, but because right now you can't get a test at a moment's notice, we're issuing guidance about when it's really important to test. And we want to remind you that there are many other layers and ways to protect yourself: masking, vaccination, ventilation, avoiding gatherings, staying home when you're ill, etc. So thank you very much. And I think James Williams, our County Counsel, is just going to offer a few comments before we open it up to questions. Thank you.
Thank you, Dr. Cody. Good afternoon. My name is James Williams, and I'm the County Counsel for the County of Santa Clara. Just wanted to take this opportunity, since we're talking about testing, to remind everyone that large healthcare systems are still subject to the health officer's September 16th, 2020 order regarding testing. What that means is that if you are symptomatic or you're a close contact and you're a patient of any of the large healthcare systems here in Santa Clara County, you have a right to a test. You have a right to a test immediately if you present, or within 1 day if you call to schedule a test. That's still in place under that health order. And if you're having issues or challenges, and we know that people are, you can visit sccovidconcerns.org. That's sccovidconcerns.org, so that we can then get that information and take appropriate responsive action with the large healthcare systems. Testing's been a challenge throughout the pandemic. That's why that testing order was put in place. And we really do need all of the large healthcare systems in the county to do their part so that the burden isn't solely on the county itself, which is currently providing a disproportionate percentage of the testing to our community. Thank you.
All right, we will now take questions from the media. We'll start from this side. If you can please identify yourself and the outlet that you're with. We'll start over here.
Sure. So the question was about the responsive action that we might take if there are issues with compliance with the testing order, and my reaction kind of to what's going on with the healthcare systems and the testing availability. The short answer is this is a health order. We have in the past taken enforcement with respect to the testing order. We're prepared to do so again if needed. But we do need to know what's happening, and that's why I put out there the sccovidconcerns.org portal, so that if we're getting situations where people are presenting and they're unable to get a test and they qualify under that order, we then find out so that we can follow up. We haven't been getting those complaints through the portal to date. That makes it really hard for us to take that follow-up action. Now, the data is pretty clear that the large systems are not proportionately providing the testing, but we really need that individual information from folks who are having challenges. So I encourage people who are to visit that portal, provide us with that information so that we can follow up. You know, the other thing I would say is it is absolutely critical for this to be an all-of-community effort. And one piece of that absolutely is the role of our large healthcare systems to provide vaccinations, to provide testing. Unfortunately, and this is very clear in the data, unfortunately, the county itself has had to provide disproportionate access for vaccination and testing far greater than the number of people in our community who rely on the county health system for their primary care. Vaccinations, that's basic primary care. That's where we go to get our tetanus booster. That's where our kids go to get their basic vaccinations. That's where we go to get our flu shots. COVID vaccines are part of that basic primary care. The same is true for this diagnostic COVID testing. People should be able to get that access from their primary care provider. That should be the first place that they can go. In our community, people are going first to the county health system. We're glad that the county health system has been able to provide that service to the community, but it is not reasonable for the county health system to provide such a disproportionate share of the testing and vaccinations. We absolutely need the other large systems like PAMF, like Kaiser, and others to step up and do their part as well. Absolutely putting them on notice, and violations of the health order are absolutely subject to the same civil enforcement as all the other health orders.
What do we have over here? You said you don't expect some relief in the testing shortage in the near future. Do you have a timeline for that? Are you getting tested with the state government? When do you think that will start to happen?
There are a lot of tests in the pipeline, antigen tests, both from the federal and the state government. And I don't have an exact timeline on that, but I would say, in the nearish future, we may see a softening of the supply crisis. It's far too early. I want to emphasize, I want to do two things. One, I want to provide a glimmer of hope to the community that this isn't going to go on forever and ever and ever. This surge that we're in right now, which is why I wanted to make sure you all understand what the sewage surveillance looks like. But at the moment, we are still in the middle of the greatest surge that we've had during the entire 2-year pandemic, and every layer of protection is incredibly important for two reasons. One, helps to protect ourselves, and equally important, it helps to protect our community and bring us through this crisis as quickly as possible. So really the focus right now is continuing to practice those layers of protection and to focus on the ones that we can control. So if there's one that we can't control, for example, testing, we do our best. And then we really focus on the ones that we can control. Thanks. What we know is that across our county, emergency departments are seeing a very large number of people coming in seeking care and requiring care. While I don't know the exact proportion that are there solely for testing, I simply know that the emergency departments are very full, and I want to make sure that everyone knows that that's not the right place to go for testing. It's the right place to go for emergency care.
Sure. So the question was, what type of situation would we want reported to the sccovidconcerns.org portal? And what we're looking for are if there are suspected violations of that September 2020 testing order. What does that mean? That means if you are symptomatic or a close contact and you have tried to get access to testing from your healthcare provider, but we're told it's not available for a week, or we're told to go somewhere else, or we're directed, for example, to the county health system, those would be violations. Those would be the exact kinds of things that we'd like to hear about. Again, if you're symptomatic or a close contact.
You mentioned that the county is taking a disproportionate amount of the testing. Do you have figures, approximately how much percentage of testing that the county is doing right now compared to the
Sure. So the question is some data around what's happening with the testing. So the county health system has about 300,000 residents that get their primary care from the county health system's clinics, but that's about 15% of the county population and has been providing over 20% of the testing. By contrast, for example, Kaiser is the primary care provider for about 600,000 county residents. That's over 30% of the county population. They've been providing around 12% of the testing. PAMF, which is part of Sutter Health, a very large health system, has about 16.5% of county residents that it is responsible for primary care, but has been only providing 2.4% of the testing. That's what I'm referring to when I'm saying disproportionate. We would expect primary care systems to be providing access to these basic primary care services.
Right. This is a question with regards to schools and testing in schools. I have just two thoughts to offer. One is the importance of in-person learning for all students. 2 years into the pandemic, we do know that our children have suffered academic learning loss, extraordinary mental health challenges, social isolation, etc. So we know that the harms of not being in school are fairly great. For most students, and there are some students for whom the risk of COVID is still quite significant because of an underlying health condition, but for most students, the balance certainly weighs in favor of being in school. We also know that there's so much COVID circulating in the community that everyone has a risk of exposure in the classroom, on the campus, in the community, at home, after school, et cetera, et cetera, et cetera. So it's getting increasingly difficult to pick out which is which. I think that there's been new guidance to schools from the state, and it takes a different tact. So rather than tracing each individual child, it's more thinking about exposure in the classroom or even indeed in the school. Our recommendation thus is simply that kids get frequent, regular testing. We understand that there are challenges in getting antigen tests into some schools not. The state has been sending lots of tests directly to schools, and we are also in contact with schools. So important that tests are available to schools. It's not perfect. We are all working together to ensure that the supply is as good as it can be to keep our kids in school.
The mayor of Santa Clara County wants people to go to a drugstore to get tested before they come in. We're talking 16,000, 18,000 people. What's your guidance?
Right now, where we are in the pandemic, where we are still in the middle of a surge, our general recommendation, not a mandate, but our recommendation is to avoid large gatherings. While there are layers of safety that can be put into place, masking, testing, vaccination, boosting, that will help a lot. There are just probabilities at work, and I would avoid large gatherings. That would be my recommendation, not a mandate, but my recommendation.
He's asking those people who plan to test before they come in, about 60,000 tests.
Yeah, it's also a challenge, so that is an option for those people, given that our community at this moment in time does not have a massive supply of tests. That might not be the best way to use the limited tests that we have.
I have a two-part question. The first part is, when a patient goes to the ER to get testing, can you be turned away under your policy, the health order, your policy? And is there anything that the county can do at this point to prevent that as you encourage people to not go to the ER to get tested?
Our job at the county in public health is to communicate clearly to the public when to use which resources and what to do. And our clear message to the public is, if what you need is a test, go to seccfreetest.org and look for a test. If what you need is emergency care because you're very ill, go to the emergency department.
All right, we'll take one last question over here. You were talking about hospitalizations, so being a concern. Can you talk about who you're seeing being hospitalized still, at least more unvaccinated people with underlying medical conditions?
The question is around who are being hospitalized, who's being hospitalized. We have looked closely at rates. So we look at hospitalization rates by vaccination status, and it is very clear that the rates of hospitalization among people who are not vaccinated are much, much higher than the rates among those who are. And among those who are vaccinated, the rate among those who are vaccinated but not boosted is higher than those who are boosted. Two other things to remember about our hospitals is it's not just that people are being hospitalized because they're ill with COVID and need COVID care. There are a lot of people that are being hospitalized for something else and test positive. But both have a significant impact on our healthcare delivery system because they require extra care with isolation and infection control.
I just wanted to add one other thing. I was asked earlier about the testing data, and obviously this conversation this afternoon is focused on testing, but I did want to note we're seeing the same disproportionality issues in vaccination delivery. And if folks are interested in that data, county health system, again, 15% of the residents get primary care from the county health system. County health system has provided over 37% of the vaccination doses administered. Kaiser, 31% of residents get primary care, only 14.8% of vaccine doses delivered. And PAMF Sutter Health, 16.5% of residents get their primary care, and only 3.5% of vaccine doses delivered. So very similar situation there as well, in case that's relevant for all of you. Thank you. I have no comment on that. Thank you.
All right, we're now going to go ahead and move over to the Vietnamese portion of the press conference.
Kính thưa quý vị, hôm nay hạt Santa Clara có buổi họp báo để đưa ra các hướng dẫn của Sở Y tế